I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
The IDD Health Matters podcast is a joint production between Friends for Life and Intellect Ability. For more information, go down into the show notes and click the link where it says Learn More here.
Hello, and welcome to this episode of IDD Health Matters. Today, I have with us three exciting occupational therapists who work in this field and are doing some great work. They're Kelly Corley. Kelly, say hello. Hi. All right. Bree Williams.
Hi.
Say hello. And Margaret Reese.
Good morning.
Welcome all of you. I really want to just get started by getting to know you and what you do. So whoever wants to go first and talk about who you are, what you do, and how you came to be in this field.
Okay. You can start. Okay, I'll start. My name is Kelly Corley, and I'm an occupational therapist here at UC Health at the University of Colorado. I work in acute care along with Margaret and Bree, but I got into occupational therapy and the IDD world. I guess in high school, I was a student aide that worked with a peer with an intellectual disability in a sewing class, and I just fell in love figuring out how to adapt projects for her. I volunteered at a summer camp for people with disabilities in Oklahoma and just figuring out how to let them participate in summer camp things was just really cool.
Sure.
I also have a cousin with autism, so just all different kinds of ways I got connected to the IDD world. And then after OT school, I started a job in acute care, which I love because it's exciting, fast-paced. And then we've developed this program, which we're going to talk about, that kind of lets us connect both worlds.
Great. Margaret, do you want to go next?
Sure. So prior to OT school, when I was studying an undergraduate at the University of Wisconsin-Madison, I was working as a CNA and a PCA in-home care and working with individuals with IDD, as well as any kind of physical disability as well. And that's kind of where my passion started for caring for individuals with IDD and various different disabilities. And then that kind of led me into my interest in OT, went into OT school. During OT school, I got involved in a capstone project that worked on sleep positioning for individuals with cerebral palsy, and also did a student rotation at a pediatric day center. So I did a lot of behavior management. I worked with behavior specialists there, kind of where I grew my passion there. But ultimately, similarly to Kelly, I really loved the medical side of OT. And so I found my passion in initially inpatient rehab and then acute care here at University of Colorado Hospital. And have loved being able to work in the neurosciences side of things. I also work on our inpatient psych unit, in addition to servicing individuals with IDD in the hospital that we'll get further into.
Excellent. And Bree?
When I was in college and right after college, I worked at 2 different residential treatment centers for kids ages 5 to 15. Who are all placed there for neuro, psych, IDD, or behavioral disorders. I also worked at a learning facility for kids with learning disabilities. Also, my mom, as long as I can remember, was a Special Olympics coach, and so I just fell in love with this population. And so after becoming an OT and working in a lot of different settings, I just realized I love working with this population more than most of them. I also work with Margaret on the behavioral health unit here.
Great. So there's so much we could talk about individually about each of you, and your backgrounds are interesting in your experience. But I think what we really want to talk about today is the program that you guys are working on and developing at UC. So tell us about that.
So our program is called the Sunflower Program, and it first developed based on a need identified by the Metro Denver Inclusion Committee, which was about 2 years ago. And that's a committee that the hospital has here for inclusion and diversity, because that's one of our big core values. And the hospital's mission is really just to improve lives. So they realized, well, we need to improve all lives, including lives of people with disabilities.
That's great.
Yeah, so there was a multidisciplinary committee, and they just decided that we as an organization could do better serving this patient population. And there was a needs assessment, and they figured out how they were going to allocate all the resources. And then occupational therapists were just selected to lead the program because it's kind of our specialization that we have in working with these patients and figuring out how to impact their environment and their occupations and their behaviors. And so our manager was part of that committee. So then she reached out to me about starting the program. And so our vision was really just to figure out how to best support these patients while they're in the hospital and how to support staff working with these patients, just the ultimate goal into improving patient experience. So from like an educational point of view, like all OTs have a generalized knowledge of this patient population, but in acute care, not a lot of people have a lot of experience with this patient population. But the three of us, as you heard, have a lot of experience from other things. So yeah, it's really just letting us combine our passions.
So I think it's great that the hospital and the system decided to include people with intellectual and developmental disabilities when looking at diversity and equity, because so often it's we think of that in terms of race and ethnicity and gender and sexual orientation and those types of things. And people with IDD aren't often thought of. So I really applaud the organization for thinking about people with intellectual and developmental disabilities as well. And there's a lot of intersectionality between people with IDD and all of those other groups as well too. So tell me more about the program, like what are some of the activities that you guys are either doing or developing to make this a reality?
Sure. So a big piece of our background in occupational therapy is that we have a sensory lens in addition to other lenses, but I feel like we look so holistically at individuals. So we'll do kind of a holistic evaluation on these patients when they come into the hospital, involving caregivers, involving patient, we'll call family members, whatever it takes to learn what we need to learn, how to best cater and care for these individuals while they're in the hospital. So it's, initially maybe do you want to go into patient interview?
Yeah, so we try and see every patient in the hospital with an IDD diagnosis. And we interview the patient and their caregivers about their likes and dislikes, communication preferences, sensory needs, pain indicators, triggers, fears, and their routines. And while they're here, we try and support them by making recommendations to our staff based on our interview and our assessment. We've done things like providing patients with weighted blankets and fidgets and stress balls, whatever they need. And also making like visual schedules and just helping with behavioral plans if that's needed.
So a question I have related to that is, do you find that you're able to identify most people with IDD or all people with IDD, or is there sometimes maybe a challenge where it's not initially recognized that the person might have an intellectual disability?
So we are working on better capturing this population. In our system, we have a disability needs tab that anybody working with the patient in their chart can edit. So if that is flagged, which is what we're doing a lot of our education on, is, hey, can you make sure you fill this out so that we can flag the patient? If that is filled out, then we're able to identify the patient. We've also done a lot of education within our department. Hey, if you have a patient with an IDD diagnosis, please reach out to our team, make us aware. And we're doing more education hospital-wide with different teams, educating them. Just please reach out to us if you have a patient with an IDD diagnosis.
Yeah. So, I'm sorry, go ahead.
Another problem we've run into is patients that most likely have IDD diagnosis but have never been diagnosed.
Officially diagnosed, yes. Yeah. So how, from a staff standpoint, from a hospital standpoint, how receptive are they to this program?
I mean, I think with time, we've been this program has been in the works for about a year or two now. And I think with time, people are seeing the worth in what we're doing. And I think that there are a lot of individuals that are on board at this point. We've presented to staff all over the board throughout the hospital. I feel like a big piece is nursing staff. So although nurses might not have individual background education in patients with IDD, I find that our nursing staff here is super receptive to any education we have for them, because I feel like the nursing staff are the ones that are with them the most amount of time during the day. They have the most face-to-face contact with these individuals. So we'll make recommendations, and ideally we connect with the nurse that's caring for those patients because they're the ones that can make the most impact. But I feel like overall there's a lot more staff getting on board with this program. We also have a new Med Peds hospitalist medicine group here at the hospital here, started in July, I believe. And I feel like our contact with them has been super beneficial as well because we're both caring for the same patients.
Sure. So have you seen so far, do you have a story maybe about how an intervention that you put into place really made a difference in a person's experience at the hospital?
Yeah. I had a patient who had really high sensory needs and was also very aware and able to communicate those needs. But figuring out how to set it up in the hospital environment was a challenge. At home, they had all kinds of tools. Everything was perfect. They had their routine to help them best regulate. So I met with them and their partner, and we really just problem solved how can we best replicate that in a hospital room. So we actually used the overhead lift as a sensory swing.
Okay.
They also.
It's another use for a lift
Yes.
that I didn't think of.
They also had their own power wheelchair that typically at home they would spin in. So we modified the room to give them space to be able to do that.
Okay. Do you think that improved that person's overall experience?
So they actually wrote a letter to myself and I think to the patient experience committee. I'm not sure exactly who the letter went to. Really delving into how they've been hospitalized so many times and how this really changed their hospitalization and how they had a lot of fear of the medical system and mistrust. And this really helped them to better cope while they were in the hospital.
Well, that's validation right there that what you're doing makes a difference in people's lives.
Mm-hmm.
That's fantastic. In any other components of the program that we haven't talked about that you'd like to share?
Another thing that we do help with are stay safe huddles. Patients all over the hospital that are having trouble, or the staff's having trouble with behaviors. They're not always IDD patients, but when they are, we are involved. And it's just accumulation of the whole team of that patient, like psych and nursing, behavioral health, and us. And we just come up with a plan for behavioral interventions. And I think we help a lot with that.
The clinicians involved, do they participate pretty early, or are they?
Definitely.
They're good with it. That's great. That's great. So you've got buy-in from the staff, it sounds like, for sure, because that's a huge part of it.
Collaborative. We feel like in those meetings, it feels like everyone wants to hear what everyone has to say, because in these patient cases, it's often, our program, we try to get involved prior to behaviors, prior to challenges, try to preemptively get in there and make recommendations to avoid challenging situations, but that doesn't always happen. So we find that stay safe huddles are often put in place to discuss when staff is being injured or a patient is being combative or aggressive, or just challenging in general. And I feel like these stay safe huddle meetings allow everybody to come together, collaborate. We all have a different perspective. And at the end of the meeting, we come up with a formalized plan to help manage and best care for the patient.
Great. So does that plan kind of stick with them? Does it become a part of their record for the next time they might visit?
Yeah, ideally, this is placed in their patient chart, and then it can be pulled up by anybody in future admissions. The group of the three of us keep an ongoing list of these patients so that when they are readmitted, we can see that, and then we'll often put in new OT orders just to show what we've discovered in past admissions, how to improve their stay this current admission. This is also something that we've been trying to streamline a little bit better through contact with the Children's Hospital on our campus. So we're working on trying to better improve the transition from children's care to adult level care through communication.
So do you work primarily with this program? Is it primarily for people that have been admitted to the hospital, or do you utilize it, say, when someone is in the emergency department for evaluation as well?
We also see them in the ED.
Okay, because that's typically a time of a lot of anxiety for anyone in that situation. So I was wondering about that, and I know that there's interest out there from other hospitals who are looking to do similar things like that. Are you? I'm going to put you on the spot. Are you guys open to talking with other hospitals that might have an interest in starting a program like this?
Absolutely.
So how can they reach you? What would be the best way?
Yeah, I feel like the best way would be through email to any of us. The three of us are frequently checking email. So any questions can go through email.
Are you okay with sharing an email address or two?
Yeah. Do you want us to send them to you at the end, or?
I tell you what, for right now, just go ahead and speak your email, but send it to me at the end and we'll include it in the notes.
Okay. Mine is Kelly, Kelly, .Corley, Corley, @uchealth.org.
Great.
Mine is Margaret, Margaret, .Rees, Ries, @uchealth.org.
And mine is Brianna, Brianna. .Williams, 2 @uchealth.org.
Wonderful. And do send those to me later too as well, and we'll make sure they're in the notes. So I mean, this is wonderful to hear, and I hope this spreads like wildfire in what you're doing. And I just personally, I know so many people that have a need for this type of service, and it's so important and so valuable. So thank you for sharing all of that with us today.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support.
I want to ask you a question that I usually ask everybody, and I usually ask everyone to give me 3 things in about 3 minutes that they think can improve the world of health and wellness for people with intellectual and developmental disabilities. But you guys get a break today, because since it's 3 of you, I'm just going to ask each of you to give me one thing that you think the audience would find helpful or valuable in improving lives of people with IDD?
I can go first. I think one of my biggest takeaways is to always assume competence,
Yes.
and to speak to these individuals like the adults that they are. That might mean you need to simplify your speech, but no need to speak to them like they're children. And I think just assuming competence. I think so often that these patients are assumed incompetent and everything is directed at their guardian, caregiver, parent, when they're the person who's experiencing their life. So they are best to speak to that however they might communicate.
Yes.
So I think taking the time to figure out, sometimes we incorporate our speech colleagues to figure out how they communicate best so that they really have a voice in their care.
Wonderful. Number one. What's number two?
Go ahead. Mine is pretty similar to Kelly's, that so much of the time when I am seeing these patients, I'm not necessarily asking structured interview questions. I just want to sit in the room and observe cares, either observe interaction with familiar individuals or their nursing staff, and just trying to figure out their needs through observation. In addition, listening to them, not making assumptions that they are nonverbal just because they're not talking to you, I feel like is a big piece. A lot of times these individuals will be labeled as like deaf or nonverbal when they're actually able to communicate. And so taking the time to figure out their specialized communication needs based on the environment and trying to adapt that is huge, but just sitting and observing can say a lot.
I love the observation part. That was always important to me when someone presents, for healthcare. I would often just sit there and observe them for a while and look at their interactions, what they were doing, how they were relating to other people, because that can tell you so much. And then not assuming that a person can't speak just because they're not speaking. That's so important and so valuable, and people can communicate in many different ways, and we have the responsibility in the healthcare field to facilitate a person's communication in the way that they can communicate. So I love that. All right, Bree.
I feel like a lot of people who don't have experience with this population are a little bit nervous to interact with them. So I would say don't be scared to talk to people with intellectual and developmental disabilities. Get to know them and their interests. They're really fun people. And like everyone else said, like just because they can't speak verbally doesn't mean they won't be able to communicate with you.
Great. Number three. People with IDD are people first, and we should treat them like people. Love that. Can't say enough about the program. I think it's fantastic. There's no doubt you're impacting people's lives, which is huge. I congratulate you on what you're doing. I can't wait to see how it evolves. I want to keep in touch. And again, just thank you for sharing what you do. Thank you for your time today. And more importantly, thank you for what you're actually doing to improve health and wellness for people with IDD.
Absolutely. Thank you for having us.
Yeah, thank you so much.